This is Radio Health Journal. I'm Nancy Benson. This week, dealing with migraines.
A lot of people think of a headache as just painful, but when you get severe headaches, it's very debilitating mentally as well.
Stopping the debilitating pain of headaches when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I think that's when you then saw pet owners go, I want more, and I want to be with my pet more and more often. I want to take him more places. And then millennials have taken it on steroids and just exploded.
The unconditional love we have for our pets. Then,
here the FDA said, well, we're going to spend, maybe up to a year trying to determine if almond milk should be allowed to be called milk. Instead, it's taken over 2 years.
How does the FDA impact food messaging? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
When you look at a computer screen for too long, a lot of people get a really bad headache right behind the eyes. They're miserable. Now imagine that feeling lasting hours, days, or even weeks. That's what some people go through when they get a migraine. And sometimes it's even worse. Nausea often goes along with the severe pain of a migraine. And they're far from uncommon. According to the National Institutes of Health, 15.9% of adults in the U.S. experience migraines or severe headaches. They force people to miss work or school and leave them in a drained state. Just ask Ryan, who gets headaches and migraines throughout the year.
I've experienced headaches for pretty much my whole life, starting from the earliest I can remember attending different day camps where I'd spend the full day outside in the sun, likely dehydrated, oftentimes very active throughout the day. And then I would come home and just be exhausted with severe, what I would consider dehydration type headaches. I'd say I've experienced similar type headaches throughout my whole life. Pretty much when I get a headache, it's pretty severe and oftentimes debilitating.
Despite that, Ryan's lucky in a way. His headaches usually arrive late in the day, and he often feels them coming. After a rough night in bed, he may need to sleep in a little in the morning, but he's usually okay. However, he says his headaches are psychologically jarring as well as painful.
I have a variety of different types of headaches, anywhere from stress-induced where it feels like, one of my eyes is going to pop out. Other times, just having the full front of the head in excruciating pain and throbbing with really no known way for myself to cope with it other than to curl up into a fetal position and put the air on as cold as it can get and just try to hope for the opportunity to go to sleep and for it to pass.
However, if you suffer from migraines, your experience is probably different from Ryan's. Dr. Stephen Myers, Vice Chair for Quality and Informatics in the Department of Neurology at North Shore University Health Systems, says anyone can get migraines, but some people are more prone to them than others, those who've inherited a brain that's oversensitive to some stimuli.
So we know it's a brain event. The brain responds to these stimulations by sending signals along the nerves that go to the blood vessels around the brain. The brain itself doesn't feel pain, but the blood vessels and the connective tissues around the brain can feel pain. And these nerves, when they get activated, they release a bunch of substances onto the blood vessels, which cause the blood vessels to swell, to dilate, to leak a lot of different proteins. And you basically get this inflammatory soup that surrounds the blood vessels and the nerves. And that inflammation seems to irritate the nerve endings, which then starts transmitting pain signals when it really shouldn't be. But there's a lot we don't know, though, about what's going on and why this happens, why at one moment in time does someone get a migraine, a lot of unknowns.
Doctors and patients often speculate about different triggers. These may range from stress to changes in the weather, although Myers says no two people are exactly alike.
The common ones that we hear over and over again In women, menstrual cycle is a biggie. Many women get migraines with their periods. And then alcohol is a common trigger, particularly red wine and beer. Weather changes. So some people will say they can predict when a storm system is coming when they get their migraine. It seems that change in barometric pressure can trigger the migraine. Alterations in sleep. So someone who either doesn't get a good night's sleep or sleeps too much can trigger a migraine. And then from there, it's just about anything. And we, hear patients say they react to all different kinds of things. Every kind of food you can think of has been mentioned at some point or another as being a trigger. It's unclear how real those triggers really are, but everyone's different. And most people, they have no idea what their trigger is.
Doctors sometimes also have difficulty figuring out the best way to help patients manage headaches. There is no real cure, so it's most common for people to reach for over-the-counter solutions, like acetaminophen or ibuprofen. But some people with severe headaches need a more radical solution, like injections of the cosmetic drug Botox. But even with potential treatments, Myers says that severe headaches should be thought of as a disabling condition. Workplaces, however, don't always understand what their employees with headaches really go through.
And one of the hard things about migraine is they're so unpredictable. You just never know when they're going to happen, and you don't know how long they're going to last. And then someone might have, typically 1 or 2 migraines a month, and then all of a sudden, for reasons we don't know, they're having 1 or 2 a week. And that goes on for a few months. So it's very difficult to predict. And they can be very severe and debilitating. I mean, if you have a severe migraine and you're throwing up and you can't take any lights or sounds, you can't work. So we always hope that workplaces will be flexible and understand this. It's difficult. If you don't have migraine, it can be very difficult for people to understand exactly what patients are experiencing.
Myers says he spends a lot of time writing letters to workplaces in order to help his patients get the accommodations they need.
There are federal laws that protect people with chronic medical illnesses that allow them to, miss work and not be punished for it. So we fill out that paperwork very, very frequently for people. And a lot of it's just education and hoping that the workplace understands and allows people to work from home. It's gotten easier now with the pandemic to allow people to work from home or, miss the first few hours of the day and then do their job if they can. Depends on what the work is. But yeah, we just hope people will be flexible.
Because of situations like that, education of other people is a large part of helping people with headaches. Myers says when those of us who don't experience them learn from those who do, it becomes a lot easier to understand.
I think probably the biggest thing in terms, and especially in terms of workplace and school, that's another big issue, same issues arise. It's just, I think most people just, if they don't suffer from it or they don't have a family member who suffers from it, they just don't get it. And that's unfortunate because it's silent. It's a headache. It's a big deal. You have a headache, but it's so much more than that. So much more.
You can find out more about this topic and all our guests on our website, radiohealthjournal.org. Our segment this week was written and produced by Bridget Killian. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
The arrival of the fall season can bring nice weather, more predictable schedules, and a variety of new activities. Eating healthfully is essential to managing the new normal, and strategic snacking can make all the difference. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Snacks are a great way to maintain energy and focus during the day, so keep nourishing options on hand, including fresh vegetables and fruit such as grapes. Grapes are easy to eat, healthy and hydrating, and they provide energy and great taste just when you need it. Enjoy grapes on their own or pair them with nuts, cheese, or hard-boiled eggs for a heartier snack.
Grapes from California are in season now. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which research suggests contribute to a healthy heart. Visit grapesfromcalifornia.com for more grape snacking ideas.
Shutdowns during the COVID-19 pandemic contributed to the U.S. plasma supply decreasing by more than 20%. The shortage of plasma could impact many people who rely on life-saving plasma-based therapies. Plasma is used to treat patients with serious diseases and conditions like burn injury survivors, people with rare diseases, and people with certain types of cancer. In fact, 125,000 Americans rely on medication made from plasma. These treatments can mean the difference between life and death for people like John G. Boyle, a patient and health advocate who lives with a primary immunodeficiency disease.
As someone who's received over 1,000 plasma infusions in my lifetime, your donation helps people like me live a normal life. That's why we're calling on everyday heroes to step up and donate plasma now.
Visit donatingplasma.org to learn where you can donate at a center near you. That's donatingplasma.org.
An estimated 4.5 million people in the U.S. have chronic liver disease, a number that's growing, according to the National Center for Health Statistics. Up to 80% of people with cirrhosis will develop some form of a condition called hepatic encephalopathy, or HE. HE results when the liver can no longer properly clean toxins like ammonia from the blood, and that can cause a temporary worsening of brain function. Dr. Howard Franklin is Chief Medical Officer at Salix Pharmaceuticals.
Many patients with chronic liver disease, especially younger patients, are not aware that they are at risk for developing HE. So early recognition of the signs is critical. Symptoms can start slowly and may go unnoticed. Look for forgetfulness, confusion, personality changes, slowed or sluggish movements, or slurred speech. In the most severe form of HE, people can become unconscious and enter a coma. If you or a loved one has chronic liver disease, ask a healthcare provider about the risk of HE and guideline-recommended therapy that may help manage the condition.
As the condition progresses, HE can have extremely debilitating effects. During October, Liver Disease Awareness Month, find out more at understandinghe.com. That's understandinghe.com.
For those who qualify for Medicare, annual enrollment begins October 15th. Walgreens makes picking a Medicare plan easier. With Walgreens Find Rx coverage, you can explore Medicare Advantage and prescription drug plans to find the right coverage for you. Compare plans online, over the phone, or in person at select Walgreens. Plus, find copays as low as $0 on Tier 1 generic drugs when you choose select plans with Walgreens as your preferred pharmacy. With Walgreens Find Rx coverage, Medicare enrollment is easier than ever. Medicare annual enrollment is October 15th through December 7th. Learn more at walgreens.com/Medicare. That's walgreens.com/Medicare.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It would be a stretch to believe that we will ever live in a world without COVID again.
Living with COVID forever.
Then how kids' allergies and asthma often start with dry, cracked skin.
When your skin is defective, then foods that are in the environment can come through the skin.
All that and more on Radio Health Journal.